My company is Professional Planning Associates, and part of our team are many other associates as well. And our company, our broker-dealer company, is a company called Cetera. They're the ones who helped us design this presentation. And Cetera, they help us put together solutions for many of your personal and business needs. Things like saving for your future, maximizing Social Security benefits for those with young children, helping with programs for saving for college, and also understanding the financial aid process, insuring in case something were to happen to you, etc. So one of the things that has been talked about a great deal is, what are the costs of healthcare in retirement? Well, because most people live 20 years in retirement, the costs are pretty staggering when you look at them. As you can see from this slide, for those who have that, for those that don't, I'll read it. It says a 65-year-old male likely costs are $135,000 because they typically live to somewhere around 84, 85. For the same female, 65, they live longer, the costs are $150,000. And I would argue that these costs are a little different because many people work beyond 65 and live beyond 85. So these are going to continue to go up. Now, many of you have good insurance for that, but even insurance costs are one thing, but there are other costs to consider. And those main costs, of course, are what happens when you become more frail. And when you become frail, you either need help getting around the house, and there you bring in aids, or as time progresses, as the statistics are, 1 in 3 people actually need nursing home care. Now, out of many people who are poor, this slide is actually has a mistake on it. It says 6 in 10 actually wind up being covered by Medicare. It's actually Medicaid that covers those 6 in 10 people. And of course, I don't want any of my clients to be those 6 people. That means they haven't saved well for their retirement and into their later years. So there are times, though, where we will counsel people that it makes sense to spend down your assets to qualify for Medicaid. And that is something we help people with too. We call that Medicaid planning. However, you have to have a number of years, 5 exactly, to make sure that you can divest yourself of your assets, either put them into a trust or turn them to your children before you can even apply to Medicaid. So there's a lot of hurdles there. The better path, of course, is let's try and save well, have enough assets so that whatever comes along, you can pay for those expenses. Now, a couple of the things that we also discuss in addition to long-term care and how you pay for it are items known as advance directives, which include a living will and other documents like a power of attorney. We recommend to all our clients to seek these out. We are not attorneys, but we can recommend you to attorneys if you don't know of one. And it's very important so that those plans are made well in advance so that when the time comes, or if the time comes, you don't have to make a snap decision, or your children don't have to make a decision where they don't understand your wishes. And we also recommend things like family meetings, where we get together with you and your adult children to discuss things like what those wishes are, how things are going to play out. You know, some people are a little superstitious with that, or a little hesitant to share. We don't have to go into details on every little thing, but it is good to lay out the big picture. So many of you may know that long-term care services include a lot of different types of items. It includes nursing homes, of course, but it also includes assisted living facilities, continuing care facilities, nursing aides that come to your home. It includes adult daycare centers. There are so many new versions coming along, and we expect that will continue as our population in this country ages, that these are decisions we all need to make. Some of them are fairly easy for those that like that. There are places like Ann's Choice where you can actually move in, live independently. And then if you ever need care, they can move you to their care centers located right in their facilities. So these are all important decisions that everybody needs to make. We're pretty familiar with nursing homes. That's where they provide 24-hour care. There's a physician on site. There's nurses on site. They have activities for, adults to do. So it can be an engaging community. Of course, though, there's a higher price tag for that generally. So we have to factor that in also, as when is the right time, how to get on the list. There's many issues that come up. They also will look at your assets. So we need to plan properly for that. And if it's you and a spouse, then we also have to take into consideration both of your needs. One of you may be more frail and may need more help, and the other one is still independent. So there's a balancing act that comes along with that, which is why it's so important to have these conversations in advance. Assisted living facilities are very popular because they can be live-in, and they also can be the type where you come to them every day, where that's the wing that would be called the adult daycare facility. They don't provide as much in the way of medical care because you don't need as much at that time of your life. And they can provide you with a community to have activities and to be engaged. So they're becoming more and more popular as a stepping stone. Okay, thank you for Patricia for putting yourself on mute. I would suggest that everybody mute, which you have done. So just unmute yourself if you want to ask a question. Now, continuing care retirement communities are a little different in that they're the ones I described earlier, the Ann's Choices. This is where you start out living independent and then move to nursing home facilities right in their own campus that they have. There's a big Ann's Choice out in Warminster that I have clients in. Also, Wesley is a company that does these continuing care centers. I'm down in the Jersey Shore in Ocean City. There's one here. There's also one up in Hatboro. And you'll see many different types of facilities like that. Genesis Healthcare System also offers them. Most of them require a lifetime contract. You either put up a large lump sum up front, like a down payment, or you pay monthly. The ones that require the lump sum payment, your family could see some of that back if you died in a sense prematurely before that money was used up. Usually there's a 5-year term there. If you die prior to that, you get a percentage of the money that was put into that fund for you. If you last beyond that, that's what the money's for. The good news about that is they will draw down on that money and use it to pay for any continual services that you need. And although you have to read every contract, and we do this all the time, that it may be that you don't have any other obligations, meaning you give up that chunk of money, could be $100,000, but then you never have to worry, even if you run out of that 100 because you were in more intensive, their intensive care unit, the nursing home unit. Even if they ran out of money at that point, then they would go and apply to Medicaid for you, or they just have to absorb it. Now, home health care is the most popular and the one we see most often initially being used because most people want to stay in their homes. So in this case here, it works just like where you have an assistant, an aide who would come in to your home, usually go through an agency, whether it's Bayada or another service. And what they do is they assess your needs, provide you with a care provider, and that caregiver will stay with you depending on how many hours a day you need. If you're living with an adult child at that point, which often happens, then maybe it's only during the day that you need the help while they're working. If it's longer than that, they even offer 24-hour care where they'll rotate on a schedule. But of course, then you're paying an hourly rate, and that's certainly, that can be expensive. Typical hourly rate we see is about $25 an hour. So, if it's for an 8-hour stint, that's $200 a day, $1,000 a week, roughly $4,000 a month. So we have to do some planning for that. But if it winds up increasing from the 8 hours, up to either 12, 16, or 24, you can see how that $200 per day will go to 400 or 600 a day. If it's around the clock care at 24 hours, $600 a day, 7 days a week, 4,200, that's over 12, almost $13,000 per month. So, and we've seen that. And so what we try and do is work with you on ways to either reduce that, or if you can afford it, then we just set up a payment plan to cover that. We talked earlier about the advanced directives. The living will is the one that deals with your medical care, what types of services you approve of and what types you would not approve of. Many have a do not resuscitate type of clause, particularly if they're older and maybe more frail and already sick. When you're younger, I don't suggest that, of course. And then you can document other types of care that you wish to get. So you have a lot of control while you're still, in a sound mind and healthy. It's a good time to do that. The medical power of attorney also gives that same power to someone else, like a spouse or an adult child. So these are important documents to have. Hospitals now require them. So I would certainly recommend to anyone who doesn't have one to go out and get one as soon as possible. The advanced directives, they're bound by state law. So one of the issues that come up, they talk about snowbirds. Well, they may have one that's good for here in Pennsylvania, for instance, or New Jersey, but not good for Florida. So oftentimes you have to check with your attorney to check out the state to see whether you need a separate document for when you're living in Florida, for instance, for the winter. And that can apply to any place that you go. So very important. It also is a document that you should put on file with a number of people, such as your physician, such as your adult responsible child, and also one that we recommend putting into a vault that you would have in the cloud. And we have this available to you. We have a program for any of our investment clients called AdviceWorks. Well, we also offer it to our insurance clients. So if you would like to have access to a virtual vault where you can store important documents and where you can pull those documents from wherever you are, then I would highly recommend you get in touch with us and we'll set you up for that. And you can load in your advanced directive, your will, your deed on your house and your car, other important documents, passport, etc. If you store them there and you ever lose them or you need to get a hold of them somehow, you have a place to get them. And so we highly recommend that. If it's not through us, then find another way to do it. But having these things in a virtual vault makes a lot of sense besides your own safety deposit box or safe in your house. So paying for healthcare and retirement obviously is also something that's pretty critical. We're going to talk about that for a couple minutes. Some people are fortunate if they worked for a government agency or a school district, they may get offered retiree health plans. Or just possibly they're part of a union or a very large employer. But for most of us working for small businesses, that's not an option. So we have to have a form of medical insurance to supplement Medicare in our retirement. So there are two basic types of plans. One is called a Medigap or a supplement, and the other is called basically a replacement or an Advantage plan. Advantage plans typically are HMO, but some are PPO. Nothing wrong with them. My general assessment is that if you're very healthy and want to pay less for your premiums, then those Advantage plans can be great. If you're not as healthy or financially don't worry about the small premium, then the supplements are even better because they're more comprehensive. So everybody's needs are different. We do an assessment and we would come up with a plan that would be right. But in either case, you need to have it. You see Medicaid is listed on there, but that again is only for those who are essentially indigent, very poor, have less than, the numbers vary every year, but I believe this year the number is approximately $15,000 to your name. It does not include your home if you're cohabitating with your spouse. That's allowed to stay with your spouse, but otherwise you have to do what's called spend down your assets to that figure. You can prepay for funeral expenses. You can have pension income that doesn't count. So you can still have assets or income. It just has to be set up right. In fact, one of the things we do is we will recommend setting up. I see, Pat, you have your hand up. So if you unmute yourself, you can ask me a question.
Yeah, hi. You meant I do work for I'm in a union and work for a large school district. So I am aware that I will be switching to a different healthcare plan in retirement. It will be somewhat cheaper than what I'm paying now. But you had mentioned something about contacting you guys for looking at all these options because I don't want to use up time in the meeting, but I have questions about, you know, Medicare,
Sure.
not Medicaid, and also questions about, you know, some other spending accounts in retirement. So, um, do you have a separate? I have a separate meeting with you
Sure.
if I want to
Excellent
talk about
question.
this. Okay. Okay.
Absolutely. And I appreciate you bringing it up, Pat, because you're right. This is not the time to go into super detail. Plus, it's
Right.
personal and you're on a
Right.
Zoom. So,
Right.
yes, anyone in that same position, please contact us. Our information we put at the end. Obviously, you can get us through Brunswick. They have our numbers, and we'll be happy to speak with you about your options and what's best for you.
Okay, just wanted to ask if you're going to be sharing this entire presentation, these slides at the end of the meeting.
Yes, we will.
Okay.
And we'll post them on our website. So you'll be able to access them again. And are we recording this?
We are recording it.
Great.
And just so you know, Pat, sometimes it takes a little bit of time for it to get posted. Like we'll post it, but I'll
Yeah.
send it.
Don't worry, that's not an issue with me. I have plenty of other things to take care of other than sit and wait for a presentation to come through. So thanks.
Sure.
Yeah, we will send an email out to all the attendees to let them know when it's available, but you can always just check on our website occasionally, but it'll be up within 2 weeks for sure. Okay, so let me continue then. So we were just discussing these different options. I mentioned about Medicaid. Long-term care insurance is a critical component for many people. There are at least 5 different versions of that. And in fact, one of them, which is little used, is life insurance. Oftentimes people say, you know what, I have enough money, but I still want to leave something to my kids. And if I blow all my money, I don't mean blow, if we spend down all my money because I was really sick, I want to leave them something. Well, the good news, as I was mentioning earlier, is life insurance, if set up right, can't be attached by Medicaid. So it is a way of putting some money aside for your future, or in this case, your children's future. So that's one option. Then there are at least 3 or 4 different types of long-term care insurance programs, all of which have their appropriate reasons for using. And in everybody's case, we would look at different options for you and find the best one. And then, of course, lastly, you just pay for it with your personal savings, which is what most people do. But the trouble is with that, most people have done it in the absence of a plan. They've essentially stuck their head in the sand and said, I don't want to talk about it or deal with it until the time comes. Not the best plan. So let's go on. Retiree healthcare plans. We were just talking a little bit about that. As I mentioned, we're happy to review those. Many times they're excellent. Other times they're not as great as they seem. Pat mentioned she works for a school district. I have many clients who came to me as teachers, and when they retire, we help them with the retirement income needs. But we also found that not all school districts' retiree health plans are the same. And so oftentimes we can get them something better outside of it. But we would, we would make sure we would do a thorough comparison. Now, here's the basics of Medicare. You have Part A, which everybody gets automatically at age 65 if they worked, because it comes out of your taxes that you currently pay. And that pays for the hospital costs and inpatient care. Part B, you have to pay for at retirement. So that doesn't trigger until you stop working. I get a call at least once a week from someone who's turned 65 and getting solicited for Part B, yet they're still working full time for, an employer. And if the employer has 20 or more employees, then the employer's health care is primary, so they don't need Part B at that time. And oftentimes, unfortunately, they do it first and call me later, and I have to give them the bad news that they wasted their money. They can then disenroll from Part B, which they do. And at that point, of course, they're saving it from that point forward. But it'd be better to talk with us prior to 65 so that you don't make a mistake. But Part B is important because it pays for doctor care and outpatient care. Now, in both A and B, there are deductibles and gaps, which I'm not going to go through thoroughly now, but leave it to be understood that you need to have either a supplement or an advantage plan to pay for those gaps. So they often call Part C an advantage plan. That's just the name that it got, but that also takes the place of A and B. And interestingly enough, the government subsidizes the insurance companies that offer that. Give you an example, two of the biggest in our area, or three of them, I should say. One would be Keystone, and others Aetna, and the other one is Humana. They all receive stipends from the government for those people who go onto their plans. So that's why they can reduce premiums, but they have other copays, hospitalization copays, et cetera. And then you have your supplements that you keep your A and your B, you show your Medicare card when you get to the doctor or hospital, and whatever isn't paid is paid by your supplement. And that happens behind the scenes, so you don't have to worry about filing claims. It's very seamless. It works well. Both programs work well. Then in addition to those, though, you must have a prescription plan. Many of the Advantage plans include prescription plans. They're built in as one, which is great, makes it easy. On the other hand, though, they're not necessarily customized for your needs. And if you are on a variety of medications, then we have a program through the government in which we can shop prescription plans and find the best one for you. Those prescription plans, though, generally can only be attached to a supplement, not an Advantage plan. So when that time comes, we'll figure it out for you as to what's best. So as I, just stated a moment ago, Medicare still has out-of-pocket costs. That's why these plans are designed. And they have all different price tags. So again, that would be another thing that when we're working with people, we look at their, overall financial abilities to handle those premium payments. So it's important depending on where you are. If you're very wealthy, you're generally going to want the best plan, and cost is no object. If you're in the middle, that's where it gets critical. And if you're poor, then you definitely need the least expensive plan. So for most of our clients are in the middle, and that's where we have to do a thorough study to determine which program is best based on your needs. Pat, did you have another question? No. Okay.
Yeah, I do. I'm sorry,
okay.
Real quick. I just couldn't do the raise hand thing real quick. It's real quick. So I think I heard you say that, can you go back to the last slide on the Medicare plans? One more back. That one, yeah. I think I heard you say that the Part C, the Advantage plan, some insurance companies work with, they get government subsidies like Aetna does. And but there's other disadvantages to that plan. Your premium might be lower, but then you have higher copays for hospital and stuff like that, right?
Exactly.
Okay, so you do comparisons. Like I also heard you say something to the effect of if a comparison shows that your plan could be better than taking your insurance provided by your employer when you retire, that's an option, because teachers have to work to either 25 years to get the medical benefits. And that's the only reason why I'm still hanging in.
Well, yes, it always makes sense to compare. First off, on the previous slide, it actually even said that, sometimes companies discontinue their policies or raise the rates. So, every case is different. The program in Pennsylvania, for instance, is called HOP, HOP, and it's not always a good deal for everyone. It depends on the age in which you retire because it's an age-based premium. So there's lots of factors that come into play. I just don't want people to get the idea that whatever my employer is paying for is the best plan. It's not a guarantee that it's a best plan. There, you need to do your homework and we'll help you with that. All right, so let me move along. Let's see, I think we were right here on this slide. We went here, yes, right here on Medicaid. So I'm only going to spend a second on this. I already kind of highlighted some of the things. Medicaid is designed for the poor. It is, unfortunately in our country, we have the haves and the have-nots. We've heard a ton about that, and recently is how COVID has hit the poor harder than anyone else. And, we're always going to have that situation. It's just the way it is. So it's designed for them. However, if you or a family member find yourself in that position, we are also happy to guide you. We don't get directly involved with them, but we would point you in the right direction. And typically that starts with contacting Social Security. Once they look at your income, because obviously they have your tax records, they would then say, yes, you are approved for Medicaid. But we know from the guidelines that you need to spend down your assets and you have to have low income. And in those cases, you can be approved. But for most of our clients, we try to keep them out of that situation. We try and keep them where they're, financially very solvent. And, and in that case, then, they'll be paying for their own. But again, back to people who say to us, well, I heard that if I give away all my assets, then I can have the state pay for me. Yes, except you'll see the last line item. It said may be subject to estate recovery laws. And this has to do with the 5-year look back. And that's the primary one. So there's other things that they can do if they felt that, if they do a little bit of research and find that you tried to get around the rules, they will come after either you or a family member who participated in that and try and reclaim those assets that should have been used to pay for them. So we have to be careful there, but we also recommend the use of Medicaid specialist attorneys to set up what are called Medicaid trusts. And this may apply to our parents. They may not be in our position and they may not have that much in the way of assets, or it could be an uncle or a friend or whoever. We're happy to help. So it never hurts to run it by us. And if we can help and give them guidance in this area, we will. The nice thing about having insurance is that you got control. You can, you have cash that you can show through a policy to a facility who really wants to be paid by you because they get reimbursed less through Medicaid. So in this instance here, you can pick a better facility. You can design, the right plan so to stay in your home, for instance. And in our state, Pennsylvania, and in New Jersey, they have a partnership, which means that you actually get to protect so much in the way of your assets from being used if you happen to go through your entire long-term care policy. Give you an example. If you had a long-term care policy that paid, I'm going to make up numbers now, $5,000 a month, that's $60,000 a year, and paid for 4 years. So 60 times 4 is $240,000. If it's considered a partnership policy, then $240,000 of your other money is protected. And if you ever spent down the rest of your money because you stayed in the facility more than 4 years, the last $240,000 that you have can't be touched. You would then be Medicaid eligible sooner than otherwise. So all of our programs we set up are partnership approved, except I guess there's a rare case where it comes up, but generally speaking, they're all approved. And that's a little known piece of information. So we know that the costs of long-term care insurance are just like any other insurance. The older you are, the more it costs. So the best time to get it is, of course, when you're younger. The second factor is the healthier you are, the less it costs. So we're always healthier when we're younger. So the same logic applies. It's never too soon to set that program up. It's certainly never too soon to at least look at the numbers and make a decision. So, we comparison shop on that. And if that's something that you're interested in, we would look to find you the right program to meet your needs. So personal savings is another option because it is true that the average stay in a facility is less than 2 years. So if you looked at what the cost of a facility is, as we were saying before, which could be $100,000 a year. So $200,000, I mean, that's not nothing. It's a lot of money, but many of you have that. You have that in a retirement account, or you have it in a personal savings. You're like, okay, I have the 200. If I need it, I know that's probably going to be okay. The trouble is you may not be the average. You may be someone who lasts longer. So if you lasted 4 years, 5 years, now you're looking for $500,000, whereas the cost of insurance can offset a big chunk of that. We call it a hedge. You can't possibly figure out to the penny. So what you do is you get what you can, and then you live with your decision that at least you did something. So again, the things we talked about is you need to make a decision and not stick your head in the sand about how you want things done in your future. And that includes long-term care issues. It includes healthcare directives and legal issues. And it considers where your assets are and how you want to set them up to cover your needs in retirement. So I want to thank everybody for being on the call. We went about 35 minutes. This is our telephone number, and there is our website. You can contact us through either. We would be happy to answer any of your personal questions on these areas. And for those who didn't attend, or those that you know of that should have attended, you can of course send them to our website to review this at their own leisure, or they can reach out to us and we're happy to have a conversation with them. So I'm going to open it up. I don't know if Pat, you have another question, or if Susan, if you do, or anyone else does, feel free to ask now.
No questions from us, thank you, but it was very good.
Okay, great. Thank you, Susan. Thank you, Pat.
Thank you, David. I just wanted to say thank you also. It was very helpful to me. It was very informative. Thank you.
Well, thank you for your kind words. It's always a pleasure to work with both of you in the ways that we do. And, we're looking forward to helping you in the future. So everybody have a great weekend, and I'll talk with everyone later.